Welcome to the first episode of Loosening Up, the KA-EMDR podcast. I'm Danielle Ciccone. I'm one of your co-hosts, and I'm here with my dear friend and your other co-host, Michele Topel. And we are the co-founders of the Ketamine-Assisted EMDR Therapy Institute.
And I'm so delighted to be here today with Danielle and with all of you. We envision this podcast as being for therapists, but also for potential clients, really anyone who might be interested in what is ketamine-assisted EMDR, and what is at the heart of this work.
Yep. So today in this first episode, it's just going to be the two of us. We won't have any guests on today. And today is really just going to be telling our story, how we got to know each other and come together and develop our friendship and our collaborative working relationship, how we developed this model. We'll see what we get into, but it's really just kind of an introduction to us and to our model and our program, and to tell you a little bit about why we developed this podcast, or sort of what we're hoping it'll become and what to expect, what's to come.
We hope you enjoy this episode. Hi, Danielle.
Hey, Michele. How's it going?
Good. I thought that maybe a good place for us to start is by explaining why we named this podcast Loosening Up and what the significance behind that is, because it may not be obvious. So I'm wondering whether you might want to sort of expand on the name of the podcast and why we called it that.
Yeah, definitely. Yeah, I mean, actually, it it sort of came to me when I was in the middle of doing a session with a client. Um, I don't know, I was thinking about developing the podcast and everything, and those words just kind of like came to me, and I was like, oh, yeah, this kind of captures what this is all about. So, what we're going to be talking about in this podcast is combining low dose ketamine with EMDR, right? And another word that is commonly used for low dose ketamine is psycholytic. So a lot of people have probably heard the term psychedelic, right? But the way that we work with this medicine is a little different. It's psycholytic. And I'm sure we'll get into a lot more about what that is. But one of the meanings of that word, psycholytic, is mind loosening. Sometimes it's also translated as mind dissolving, but I've often heard it as mind loosening. And I think that's actually a very appropriate way to describe it, because that's kind of what it is, right? It's like when people take that low dose of ketamine, it's just kind of like a gentle softening, loosening up, right? Of like rigidity and defensiveness and, being like closed off. And there is kind of like an actual like relaxation, right? The body can feel a little looser. So I just thought it captured what this is all about. And I also thought it was kind of cute and catchy and fun, right? Um, so yeah, loosening up, right? It's like being able to work on hard things in therapy from a little bit of a softer place,
Mhm.
right?
Well, so I guess the next question is, why combine ketamine with EMDR therapy? What is the point of that? I wonder whether we could maybe both share, like, why did you decide one day that, oh, this might be a good idea? I think I'm going to do this. Like,
Yeah.
what is your story? And then maybe I can share a little bit about what happened with me.
Yeah. And I mean, what's really cool is it sounds like our stories are very much aligned, which I'm sure is why we've gotten along so well and this has worked so well. But yeah, I mean, so I've been a therapist for, I think, about 14 years. And I won't go into all the history because that'll take a long time. But, EMDR was one of the main tools that I learned pretty early on. Like one of the main experiential, certainly the main trauma healing modality that I learned. And I just totally fell in love with it like right away. And so I was practicing that for several years, maybe, I don't know, maybe about, I want to say maybe 3 or 4 years, something like that. And that was going great. I was loving it. I was seeing great results. I was doing it myself as a client, totally loving it. And then I got word of ketamine assisted psychotherapy. And actually, interestingly, I had personal experiences with psychedelics when I was young. So I was not surprised to hear that like psilocybin or even MDMA were being used therapeutically. That made sense to me. I mean, I actually had some experiences myself that were in alignment with that. but I never actually really knew anything about ketamine. So it was like a totally brand new, concept. The only thing I knew about ketamine was that it was like you know, used for tranquilizing animals. So when I first kind of heard about ketamine assisted therapy, I thought it was kind of crazy at first. But then when I actually started reading, the research and understanding more about it, it was like, oh, this actually seems like a really useful tool. Um, and so without even thinking about how it could be combined with EMDR, I took some training programs. I got connected with a company called Journey Clinical, which is a great company. It helps therapists get connected with medical providers who actually have to prescribe the medicine. And so they, gave me some training and helped me understand it. I did a year-long program with the Integrative Psychiatry Institute, all about ketamine assisted therapy and other psychedelic assisted therapies. And so at first I was just kind of doing that, and I know I've heard you say the same thing, kind of separate from EMDR, right? I was still doing that, loving that, learning how to bring ketamine into my practice. Um, and it was interesting and it was cool and I was excited about it and I was hopeful about it, but it felt like it was missing something because I was so used to the structure of EMDR, right? And like how we target things in a very specific way, and there was just more to it. And the very open-ended way of working with ketamine that I was learning, um, I mean, it was interesting again, but it just felt like something was missing. So, and then we hear things like ketamine is helpful for neuroplasticity, and ketamine, helps people maybe get in touch with things that they otherwise have a hard time getting in touch with. So I was kind of thinking about that and thinking, okay, well, then I wonder what it would be like to combine the two, right? So, yeah, I mean, I think I just naturally kind of started to develop some curiosity around that. And it sounds, I'm sure your story is kind of the same, right? And there were some people talking about combining the two. There weren't that many, even just a few years ago. It really wasn't like a major conversation. Um, so I kind of was, asking around, talking to other people, and just started kind of playing around with it, just kind of playing around with the combination, um, and mostly doing it kind of in the psychedelic way, right? Higher doses of ketamine where people would have a journey, and then they would have EMDR maybe on a different day or something, but close together. And that was cool. That was, helpful, seemed interesting and helpful for people. But I got really, really curious about what would happen if they actually took the medicine while they were engaging in EMDR. And so I was dabbling with that, playing around with that, trying to figure out how, but there wasn't much clarity to it. Even the people that I did hear talking about it, they gave me some ideas, but it never felt clear of like, well, how exactly do you do that? Right.
And
So,
why?
and why? Yeah. And what's the rationale for whatever the answer is? Um, so yeah, I mean, basically when we met and we started to explore that question together, and that's where it really took off for me. I mean, I definitely already knew before you and I connected, okay, there's something really magical here, but it certainly didn't feel as clear as it does now, right? And so, like, being able to work that out together was just awesome.
Yeah.
So let's hear your story, which I'm sure is very similar, but
Yeah, it's almost the same story.
right.
Um,
Yeah,
yeah, I actually became interested in EMDR therapy first because of my own experience as a client
right.
doing EMDR therapy. I had a lot of my own unprocessed stuff that I'd been talking about for a really long time, decades, honestly, but
Mhm.
nothing had ever really shifted. Like, I could think differently about some of the things that happened to me, but I wasn't really feeling differently. I would be in different situations where I would find myself being triggered, and um, I wound up uh, connecting with a really brilliant EMDR therapist here in Washington, D.C. And
Mhm.
after a couple of EMDR sessions, I was like, wow, this is it. This is like,
Mhm.
this is really cool. And so I became really passionate about EMDR therapy, and I got trained in it. I eventually became, certified and a consultant as well.
Mhm.
Um, so that was my primary modality for some time. Um, and then I don't even really remember how I got interested in ketamine or psychedelics in general. Um, I think in part it was because I had a colleague here in Washington D.C., and I think she might have brought to my attention the fact that there was this uh, CAP or ketamine assisted psychotherapy training that was open for registration in California, where it was
Mhm.
actually Dick Schwartz who was teaching, who was one of the instructors
Mhm.
for learning ketamine therapy um, with an IFS lens. And I
Yeah.
thought, oh man, this is going to be cool. Sign me up
Mhm.
for this.
Right.
And so this colleague of mine and I, we went to this training. This was maybe 3 or 4 years ago, out in California, where Dick Schwartz and Sonny Strasberg and a few other folks were doing this CAP training, and it was using, just like in your experience, it was
Mhm.
using the higher doses, the psychedelic doses. Um, I did have some reservations or some hesitations because um, I'm in long term recovery, so I've been sober
Mhm.
since 2009, and I was like, "Ooh, I don't know
Mhm.
about this. I don't know whether I want to, um, take this medicine as part of this training," but I was starting to read the research, and I was
Mhm.
like, the research seemed pretty compelling, um, but I just wanna learn about it just from the psychotherapist perspective, like,
Right.
what is the benefit to providing this kind of therapy and wanting to get trained in it.
Mhm.
Um, and so I went through this training, and the things that I learned in the training, we wound up being paired up in dyads, and I did wind up actually playing the part of the client in that training. And during that experience, it was like, I think for me, part of why I made that decision was because I felt like if I was going to be providing something like this to a
Mhm.
client, I wanted to really understand what the experience was.
Yeah.
And I'm so glad that I did, because it isn't just like, "Oh, let's take ketamine and
Right.
let's get high and, like, do some
Yeah.
EMDR." It was really about, for me, and I think for most of, the clinicians who were in this training, not about, like, trying to run away from something, but about, like,
Mhm.
having a tool that would help move towards something, to
Right.
be able to move towards difficult material, which is what you need to do in order to process it.
Right. Yeah.
Um, so I came back, and like you, sort of, I had the ketamine assisted psychotherapy that I was doing, and then I had the EMDR therapy that I was doing. Um, and I think after a few months, maybe, I started to become comfortable enough where I was like, huh, you know, I wonder what would happen if I
Mhm.
started to incorporate it into the actual EMDR reprocessing. And part of how I became curious about that is because there was this certain subset of clients, I don't know, maybe 20%, maybe 30% of my clients.
Mhm.
Most of them would get well pretty quickly, and I would start to see a lot of changes and symptom reduction, and sometimes really transformational change, because you can get that with just EMDR alone.
Absolutely. Yeah.
Um, but there were certain clients, and there's actually one in particular that comes to mind, who had some really severe, horrible childhood trauma, and she just
Mhm.
couldn't go there, just
Mhm.
couldn't go there. And I know, just because of my training as a trauma therapist and EMDR therapist, that, in order to heal whatever this wound was from the past, you really
Mhm.
need to go in and
Mhm.
and approach whatever this difficult experience was, so that you can finally just, like, bring it into awareness and
Yeah.
move through it, and get it processed. And so with her, and I was talking to her, of course, the whole time about this, and she and I had actually done a couple of higher dose CAP sessions together, and it was good.
Mhm.
It was productive. But I said, what would you think if we did just a low dose of this and
Mhm.
combined it with the EMDR reprocessing?
Mhm.
And I also feel like I have to add that I was working very closely in tandem with a psychiatric nurse practitioner. So, very
Right.
important to stay in our lanes here.
Yeah, and
Um,
actually, maybe I'll just quickly give that disclaimer here, right? Like, we
mm,
probably should say that right off the bat, that this when we talk about using ketamine in therapy, we're talking about it being prescribed by a medical professional, this is
self-administered.
self-administered, at least in the way that we work with it. So, if that wasn't already clear, we'll make sure that's clear. So, yeah.
Yes.
Yeah.
Thank you.
Yeah.
So anyway, so with this one particular client who just couldn't approach this really touchstone significant childhood trauma,
Mhm.
um, we added a low dose of ketamine, or she self-administered the low dose of ketamine,
Yeah.
um, as we were processing, this memory, and it was magic. It
Mhm.
was unbelievable.
Mhm.
This woman, after a year of just sort of
Yeah.
like beating our heads against a wall where
Yeah.
she just could not approach this difficult memory, she had a huge cathartic breakthrough.
Mhm.
And the material finally moved, it was processed, and the process of healing could finally begin.
Yeah.
And I mean, I get goosebumps even right now just remembering what that was like. And at that
Mhm.
time, I was like, what just happened?
Right.
There's
What is this?
something, there
Yeah.
was something that I wanted to really understand.
Mhm.
And then, I started to do this with a few more clients, and the magic
Mhm.
continued to happen. And places where people were stuck
Mhm.
became loosened up, right?
Exactly. Yeah.
Um,
Right.
and
Yeah.
and so at that point, I was talking to some colleagues, actually some colleagues in the UK. I don't remember how I got connected with them, and a few other folks too who were sort of leaders maybe in the field of EMDR therapy. And I was like, is anyone else seeing this? Is anyone
Mhm.
else doing this? They're like,
Mhm.
no. So, and so I thought, okay, well, I guess I need to do something with this. And at
Mm.
that point, that was how, of course, you and
Mhm.
I got connected. So do you want to sort of pick it up
Yeah.
from there?
Yeah, definitely. I kind of want to just piggyback off of what you were talking about with your own experience because it was very similar for me. So it's just so funny how our lives really have so much similarities. But yeah, I mean, part of my training too was that experiential component, right? And I struggle with the same thing because I've also been sober for a long time. And I was really not sure if I was going to take the medicine. And I actually went to Colorado. I'm in California, traveled to Colorado, told them, nope, not going to take the medicine. I'll be in the therapist role. Please get a volunteer. And for whatever reason, when I got there, I was like, you know what? I think I feel safe enough, and I think, like, this feels right for me to experience it, and just like you, like, I'm so glad that I have. I know there's gonna be people out there who might wanna do this as a therapist and may never have the experience of self-administering ketamine, and that's okay, right? Like, it really is okay. There are really good reasons why some people can't or just don't want to, but I know for me, it turned it more from just a theory and a concept to, like, an embodied
Hmm.
understanding of what the heck this is, what it feels like, what the experience is like. So, I just wanted to, kind of share that too, I think that really, solidified my interest in it, was having that personal experience. So I think it's something that a lot of people will grapple with, if they wanna learn this or they wanna provide it, do I need to experience it? And
Yeah. I mean, for me, as I already said, I was very reluctant, but I think when I got into the training setting
Mhm.
and I could see, like, these were serious people.
right.
I mean, it was Dick Schwartz, for crying out loud. These were,
Mhm.
you know, doctors, these were psychiatrists, these were people who were researchers, these were,
Right.
you know, it was a
Yeah.
serious thing. It wasn't really sort of what I expected. And I think when I started to really understand the science behind it.
Mhm.
And actually that was also a big part of it. And I think I've shared this before. One of the things that you and I have in common, uh, besides being in long-term sobriety, is that we're both uh, nerdy, I guess you can
Just
say.
a little bit.
Um, and so I was during this period of time, I was reading, and this is like the stuff I read for fun. I was reading an autobiography of Oliver Sacks, who was a famous neuroscientist, for those of you who may not know that
Mhm.
name. And I was reading this book that Oliver Sacks had written, and he wrote something in there about glutamate. Like, I don't know why or what the context was, but anyway, he was writing about something having to do with glutamate, and I knew as the result of my training
Mhm.
in CAP, the higher dose CAP, that glutamate is, is released, and it's one of, like, the primary,
Mhm.
um, mechanisms of action of ketamine, that ketamine, uh, releases glutamate, or it makes it more available,
Right.
and Oliver Sacks in his book said, "Oh, something about glutamate being the neurotransmitter most responsible for information processing." And when I read that, I was like, "Bingo. This
Mhm.
is it.
Yeah.
If this is the neurotransmitter responsible for information processing, and if what EMDR does is
Mhm.
information processing, it makes perfect sense
Mhm.
that combining these 2 things would, at least in theory,
Right.
facilitate that, information processing that happens during EMDR therapy."
Yep.
Um,
Yeah, so I
so
mean
oh, go ahead.
yeah, I mean, there's just so much neuroscience, right, to support it. And then kinda like what we were saying in the beginning as we were explaining the title of this podcast, there's also kind of the subjective experience, right? So there's what happens in the brain, the glutamate, the neuroplasticity, the downregulation of the default mode network, which we may or may not get into more today. But, and then there's kind of the subjective experience, which I just find so fascinating that it can really kind of bring down the psychological defenses, right? And I had been really deep in my EMDR training and, learning all about complex trauma and how EMDR can get blocked for a lot of people. Like you were saying, there was a subset of your clients that couldn't really go there. And I was experiencing the same thing. And that's really common with more complex, especially like early trauma. And so when I kind of heard, oh, and not only does it, help the brain in many ways, it helps the person subjectively be feel safe enough, to kind of go to places that they otherwise couldn't go, kind of like what you were describing with your client. And I just, I'm like, okay, well, that sounds like exactly what we need, right? I
Mhm,
mean, it's so funny now these days, like every time I go to a training and it's all about, the different strategies that we try to use to get around the blocks, basically. My brain's like, well, we could just use ketamine and that'll solve that problem, right? And I know it's not that simple and it doesn't always, but it really does kind of help loosen up the blocks, right? Or
mhm,
it can. And that was one of the things that really, really interested me because I was also, I think around the same time that I got trained in CAP, I was also exploring my IFS training, um, which is all about, the protective system and the protective parts that actually kind of block access or intend to block access to the trauma, to the feeling of the trauma. Um, and, so I was like really trying to learn a lot about how do you work with that protective system with those parts, with those defenses. And so again, when I kind of learned that ketamine can help soften that, loosen that. Similar to kind of the aha you had with the glutamate, it was like, "Oh, this seems like a no-brainer." Like, of course these should go together, you know?
Well, and
So,
also just like the caveat that you had about working really closely in tandem with a medical, professional who can prescribe and who does the medical
yeah,
piece, I think it's also important to point out that there are certain people for whom ketamine is not gonna be appropriate, or even EMDR for that matter, right? I mean, there
right.
are some contraindications, and it's not gonna be for everyone, but for people for whom it's appropriate,
Mhm.
it really is amazing. And also, talking about IFS, one of the things that I remember Dick Schwartz saying in the ketamine IFS training was that from his perspective, and I definitely see this, and you and I talk about this a lot, that
Yeah.
even with the very low dose of ketamine, with the psycholytic dose of ketamine, that there seems to be access to what in IFS we call self-energy, right?
Mhm.
That there's, and actually Francine Shapiro, in her book and her work on EMDR therapy,
Mhm.
talks about like a witness consciousness and,
Yeah.
that mindful awareness, whatever you want to call it, self-energy, the sort of compassionate witness who can kind of just take a step back from whatever the experience is and observe it in a compassionate way.
Right.
That seems to become more available, and again in IFS language, that the protector parts tend
Mhm.
to soften and kind of take a
Yep.
nap for a little while. you
Yeah,
uh,
or at least, yeah, step aside a little bit more. Yeah.
yeah, yeah.
And I don't know how much we wanna go into this. I'm sure there's so much we could talk about today that we probably won't get to everything, but, um, I really loved the idea of just working gently with the medicine and not and because truthfully, like, when I was first starting to practice CAP, and offer it, I'm not gonna lie, like, there were some times where I'm like, "Oh gosh, I'm a little nervous about this, like, what's gonna happen," right? The person's gonna take this relatively higher dose of ketamine, and by the way, it's not like the same amount that you would get for anesthesia, right? So it's still like a much lower dose, but comparatively from psycholytic to psychedelic, there were times where I'm like, "I don't know what's gonna happen. I don't know, if this is gonna be too much for this person." The person was really nervous, the client was really nervous, and it was kinda like a little unnerving, right? Like, what's gonna happen? But with the lower dose, it's just this nice gentle opening, right? It's not I don't think I've ever had a single person feel scared by it or feel
Mhm.
overwhelmed or feel, um, yeah, like anxious. But I have seen that with the higher doses and
Yeah.
understandably, right? Because the
Mhm.
whole idea, as you know, behind kind of the psychedelic approach is what do they say? Trust, let go, be open, surrender, right? Let go, surrender, which in theory sounds lovely. But as we know, particularly for people, especially with like complex trauma,
Mhm.
that's actually a frightening idea,
Yeah.
right? So,
Yeah, I mean, psychedelics, like, not everybody is gonna be up for that.
yeah, yeah,
And yeah, there's a lot of good reason why people wouldn't want to do it, and also just from a scheduling perspective. I mean, during those higher dose cap sessions, I'd be blocking out 3 hours essentially
Mhm.
to do that, and
yeah,
with the ketamine, or the KA-EMDR, it's a little bit longer than a standard 60-minute session, but not that much longer.
Mhm.
So it's very approachable, it's very doable both from the
right.
clinician perspective and also from the client perspective.
Yeah, it just
Um,
doesn't seem as daunting, right? In all
right.
in all ways. And that's what we hear a lot from our students is like, "Oh, okay, like I could do this, right? I can offer this." So So yeah, I totally agree with that. I think approachable is a great word. So, okay, so we should probably go back to kind of when we came together
Yes.
and how we sort of figure this out together. Because I think from what I remember, and tell me if you remember it differently, but we both felt pretty confident about what we were doing, but there were some unanswered questions and there were some details that I think neither one of us had really worked out yet in our practices and and so when we came together, it was like, "Okay, we're gonna figure this out," right? Um, so yeah, I mean, it's just so funny. I still remember the day when you put out a
It was
post,
July of 2024.
July of 2024, where Michelle put out a posting on a group that we're both part of. It's a networking group for people that work with ketamine therapeutically. And it was almost as if I could have written it myself, right? Essentially, Michelle was reaching out to look for somebody to collaborate with, to research this. And I was like thinking the same exact thing, at the time. And I just remember reading your post and immediately I knew, like, oh, okay, I found someone to do this with, right? And so we connected, we met on Zoom, I think, like, just a couple days later, started talking about our own paths, and immediately hit it off. I mean, I think we might have started talking every day, like,
Yeah.
from right at the start, like something just clicked, right, between the 2 of us. It was so cool. It was just so I mean, it was more than like a for me at least, and I think you feel the same way, but it was more than just an intellectual, like, "Oh, we're interested in the same things." It felt like I know it's gonna sound kinda funny, but it felt like we were supposed to come together to do something important, and
Yeah, it was very synergistic. In fact,
yeah,
it's so funny because when I started pondering, like, am I gonna like, how am I gonna research this? Do I need to write about this? Do I wanna do a case study? What do I wanna do? I
Mhm.
had dinner actually, I had dinner with the colleague who I went and did the CAP training with,
Mm.
and I said, I wanna do something with this, but I know I need to meet someone who I haven't met yet." And
Hmm.
literally less than a week later, you
wow.
responded to the post. I don't think
Oh,
I've ever told
I
you that.
I don't think you have. That's so
Yeah,
sweet. That's so
um,
sweet.
yeah, and also I think pretty quickly we found out that we were both in recovery, and then at that point, it was like we
Yeah.
became BFFs.
And I mean, and that really was important to me, right? Because
Mhm,
I don't think I had yet met anybody, unless I'm forgetting someone, but I don't think I had met anybody in any of my trainings or the people that I was starting to connect with around psychedelics, psycholytic, whatever, using a medicine, who was sober.
mhm,
I'm trying to think that, I mean, other than the fact that there's the psychedelics and recovery 12-step group, which I want to give a little plug for. Um, and I was interested in that. So I knew there were other people in the world who were, considered themselves sober, right, in recovery, but were open to using these types of medicines therapeutically. But I didn't really have a personal connection with any of them. So it felt so important and just so safe, I think, to do this together because it was like, okay, we come from the same background. I think we were both equally curious but cautious. It just felt really safe, and I think we said this in a training the other day, but in my opinion, it's a really strong um, strength, I think, for us as trainers that we come to this with some cautiousness, right? And like responsibility.
mhm,
Um, because listen, like as great as ketamine is, it can be abused. It is abused by some people,
mhm.
right? There are risks, like there are some dangers to it. And like you're saying, it's not for everybody. So, like I think we both have a healthy amount of cautiousness and responsibility around it. So
Mhm.
yeah, like that just really solidified for me, like, okay, this is someone I can work with, you know? So it was a big
Y
deal.
Yeah, so we pretty quickly, I think, decided that because I had already been collecting, um, uh, data, I guess, just like normal outcome measures of trauma symptoms,
Mhm.
with I guess it was 8 clients that I had been working with here in Washington, DC, that
Mhm.
I already had, yeah, I had data that we could work with, and so you and I just, started to review the data.
Mhm.
We started to review the protocols um,
Yeah.
and wound up deciding that we wanted to, yeah, to write a
Mhm.
full journal article. So what we wound up doing, of course, was a retrospective clinical chart review where we did go through an IRB, an
Yeah.
institutional review board, but they determined that it wasn't human subjects research. So at that point, once we got the IRB
Mhm.
thumbs up, then we
Yeah.
started doing our thing, and it took longer than I thought it would.
Oh,
Um,
yeah. Well, the getting it published, I have to say it was so fun for me though, because part of my background is I started as a researcher. When I went to grad school, that was what I thought I was gonna do. I went to a PhD program, thought I was gonna be more a researcher than a clinician. And that didn't end up being the path that I ultimately went down, but it was so fun for me to, like, dust off those old skills and be able to run the analyses, and it fulfilled a thing in me, um, that was really important. So,
mhm,
that was that was really cool to get to do that, um, and I mean, like, it was just so shocking that nobody had actually published anything. I mean, there were some, blog articles and things like that that people had written, but there was nothing, no published peer-reviewed research on this, which was pretty wild, So, like,
Mm.
it was so cool for us to be able to contribute something, even though it's a small study and it has lots of limitations, um, to, like, start hopefully a growing body of research, and here we are, we're 2 private practice therapists, we don't have any funding, we don't have any big institution behind us, right? Like, we just took what we had and tried to, you know,
Mhm.
put it in a in a form that could be published, and yeah, it did take a while, but I think it was so worth it, and I really am excited to see how that hopefully launches, bigger studies and just more interest in this.
Well, I think in my view anyway, the biggest contribution that this, article made was the research that we discovered about the timing of
Yeah.
ketamine administration because, I mean, gosh, it was every day you and I would be sending
Mhm.
research articles back and forth. We were always on PubMed. Oh my gosh, have you seen this? Have you seen
Mhm.
that? And, there is a fair amount of research being done, on, the neuroscience of
Yeah.
ketamine and what is it that happens there. And we found um, a handful of, I think, some really important and recent journal articles from researchers. I think mostly in Europe and maybe the UK,
Mhm.
but
Yeah.
where they were researching ketamine very specifically with memory reconsolidation. Like, how does
Mhm.
ketamine affect memory reconsolidation? And of course, memory reconsolidation is what we do in EMDR. I
Mhm.
mean, it really is the mechanism behind adaptive information processing, AIP.
Yeah.
And so again, when we saw, oh, ketamine potentiates uh, memory
Mhm.
reconsolidation, that was just like further
Oh, yeah.
confirmation that we were on the right track. And
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 it's funny
again,
because we didn't actually know that.
no, we
I
didn't.
mean, we saw it happening in
Right,
practice, but we didn't know the science, I
right.
remember that, like, discovering that because I was really deep into Bruce Ecker's work, and his book, Unlocking the Emotional Brain. I was really deep into studying memory reconsolidation. So, yes, I remember when we discovered that research, it was also another light bulb aha moment, and prior to us, I don't really think there was anybody else talking about that aspect of it,
And
right?
I still haven't heard anyone else talk about
Yeah,
it. But it's really, really important. And like I said, I think that's maybe one of our,
yeah,
if I could say this, one of the biggest contributions that we've made to
yeah.
understanding the psychopharmacology or the pharmacodynamics, quite frankly, of
Mhm.
ketamine and memory reconsolidation, because the timing of administration is critical, and there's a lot of research now behind that, and
Yeah,
so we were very informed by that as we refined the
right.
protocol that, of course, we're now teaching.
Yeah.
Um, so yeah, it was amazing really how it all came together and
Mhm.
how you and I, like, for, going on 2 years now, we talk to each other every day.
Mhm.
Like, it's like, and I've said this before, we're like EMDR and ketamine. The synergy is amazing.
That's so true.
We're
Yeah.
so yeah, it's been really
Yeah. And I know for
amazing.
me, like, I don't know, would I have done all this by myself? I don't know, maybe, but there's just something about being energized by each other, right? And if I'm exhausted, you have energy. And if you're exhausted, I have energy. And it really kind of helps balance each other out, right? And kind of keep things fresh and keep the creativity going. So something like the collaboration, the partnership, right? I think really supported because we've done a lot. We've put out a lot of things since we met, and we'll talk about our training program in just a second. But it just blows my mind, like how fast it all kind of happened. But I really do think it's something about our like energies combined, right?
Mhm.
That allowed it all to kind of come to life. So yeah, I mean, our original intention was just to do a research study, right? And then I don't even remember exactly how we
It was
decided, but
you. It was totally your
okay,
idea,
so
so So do you
Yeah.
want to talk about the Training Institute? Because I do
Yeah.
remember for me, it was like, let's just finish this project, this research project,
Uh-huh.
and I'm going to just call it a day because this is enough for me. And you were like, oh, no, no, no.
Yeah.
We need to do something else with this. So do you want to kind
Yeah.
of take it from there?
Yeah. I mean, it just felt like, well, shouldn't we be teaching it to other people? Right? Like, why not? We feel like we've kind of nailed something really important. And by the way, not that we don't have more to learn, of course we do. But I think once we really got clear on how to do this and why and all the research that was behind it, all the stuff that we had to figure out to write that publication and to just improve our work with our clients, it was like, well, we've got like really important we have something really important to share here, right?
Hmm.
And again, like I know that there were other people providing trainings, which are all, wonderful. There's other wonderful people contributing to this, body of information. But it was like, okay, there is something specific here that we can share, so or something a little different that we can share. And so yeah, I mean, gosh, that was a big undertaking. Both of those projects were huge undertakings, the publication and starting a training program, but
And running full-time private practice.
yeah, gosh,
Yeah.
it was so much. Thank you to my husband for putting up with all that and my kids. But, yeah, I mean, we decided let's go ahead and put together a training, and so we taught a couple courses live
Hmm.
in early 2025.
Yeah,
Um,
January and March of 2025. So
yep,
almost exactly a year ago, we were teaching our
yeah.
first live courses.
And I mean, it was incredible the amount of like interest, the number of people that signed up. I think we were both shocked. I knew there would be interest because I knew it was kind of a hot topic, but boy, like I was not expecting as much interest as there was. And then, because we were both busy people and it was hard to find time to teach those classes live, we figured, well, let's put it on demand, so more people can access it and people can watch it at their leisure and go back and rewatch it and everything. So we put together that introductory course, which is um I think it's fantastic. I really love it. And we've heard really, really good things about it. There's all the science, there's all the theory, and then we had the privilege of having a couple people allow us to record their sessions, which obviously, being able to watch that and actually watch a demonstration of what this looks like and how people can resolve extremely painful things with this method, I think people really appreciate seeing that. I know
Mhm.
I do, right? I love being able to see it in action. So it's been really cool. And then at some point, I had another bright idea
Yeah, it was
of
your idea again. I was like, "Are you serious? You really wanna do more?" And
yeah,
then you decided we should do a video or a virtual experiential training, which
right.
initially was like a 2-day, like a Friday and Saturday or something,
Yeah,
I
I think
think the first one was, or
Yeah, I think we did it on the weekend, and it
Mhm,
was like, well, let's get people, together practicing this, right? And I
mhm,
was like inspired by other experiential trainings that I had done. I mean, first of all, basic EMDR training has that practice component for those of you that haven't been through that yet. You practice doing the therapy and you practice receiving it. So I thought, well, why couldn't we do that, right? And you and I both had experiential elements like we talked about before with our ketamine therapy training. So I'm like, let's do it, but we live on opposite sides of the country currently. And so finding a way to make it happen in person just felt like a lot. And so I was like, let's give it a shot doing it virtually. Let's just see how it goes. Right.
if no one shows up or if 3 or 4 people show up,
Yeah.
it'll be
And,
worth it.
and it's, my gosh, there's been, again, so much interest in it. And every single one that we've done, and I should have counted before we started this, but I think we've probably had more than 10, maybe, I don't know, 12 or something of these experiential trainings now. And we typically have about 8 people come. So they're small, they're intimate, and Michelle and I are both there. Every single one has been awesome, right? I
Mhm.
mean, every single one, there's been, I would say, the majority of the people that come, if not all, but the majority of the people say, wow, that was an incredible experience, you know?
Yeah,
And it's
it
just
it it amazes me every time that there's always at least one and usually more, therapists who come to these trainings where it's this weird container. It's like a training, and you're coming to this training with some personal piece of work that you want to do in the training. And often we'll see therapists coming to these trainings and they'll like bring something that they've been working on maybe for years and years and years, where it's just like, this one thing that you just keep
Mhm.
chipping away at. And people have transformational experiences where things that they've been working on for sometimes decades, they have some kind of deep insight or resolution or some big transformational or transpersonal experience.
Yeah,
Yeah, it's really cool to be able to facilitate it, and I think
totally.
the the reviews from the students so far have been pretty overwhelmingly positive.
Yeah,
And then, of course, from there, it only made sense for us to then offer consultation as well. So each of us
right.
have either individual consultees or offer group consultation.
Yeah. Yeah, so again, I mean, all of this stuff, it started with an idea, right? And then we just try something out and it's been great. So yeah, I mean, we've had hundreds of people now, sign up for this.
300 or more?
350, I think the last time I checked, and it's just, and I'm sure not everybody is totally putting it into practice, but maybe I'll kind of segue to this podcast. I had the idea of doing the podcast because I thought, well, let's, have the people who are learning this and are implementing this and actually
Hmm.
practicing it. Let's hear from them, right? So it's not just me and you sharing our stories, because in
Hmm.
consultation, I would be hearing people say,
Hmm.
oh my gosh, I'm seeing such cool results, and I would be hearing these stories and I was like, we gotta interview these people, right? We have to have a platform for people
Hmm.
to be able to share what they're seeing
Hmm.
in the therapy room, right? So that was the main thing that kind of inspired the idea of the podcast. So I think probably most episodes will be us, um, you know, with a guest who is somebody who has gone through our training and has actually not only taken the training, but really started to implement it in their clinical practice. And of course, we won't be able to get into the nitty gritty details of the cases, for confidentiality reasons. But I want to highlight and showcase these awesome people who have trusted us, you
Mm.
know, to learn something new and try something brave in their practices. So I'm so excited. I can't wait to be able to have these conversations with these people who are just we have just the coolest students, like sweetest
And they're from
people.
all over the world now. We
Yeah.
had someone from Lithuania in our training recently. We've had students from Poland, from the UK, from Canada.
Yep.
Um,
Yeah.
so it's just been incredible.
Yeah.
And again, it's been amazing how well it seems to have worked to be doing this virtually. And in fact, I mean, you and I
Yeah.
talk with each other virtually every single day now for almost 2 years, and we've
Yeah.
only met each other once in person.
Yeah.
And that,
That's the funniest part of this whole thing is that we didn't actually meet each other in person until we went to the EMDR-EMDRIA conference last September. So it had been over a year that you and I were collaborating and doing everything by phone, text, Zoom, and email. And then we actually got to spend some time together, which was awesome.
yeah,
Um, so yeah, I mean, it is amazing how much can be done virtually, and I really do hope that at some point we are able to expand and offer some things in person because I love doing that kind of stuff. But
mhm.
I think one of our main goals with our program is we want to make this accessible. I mean, psychedelic therapy training programs cost a lot of money. I spent way too much money on the training that I got. I mean, I appreciated it, but it was like way overpriced, and I think we are trying to make this accessible for people. So, being able to offer these things virtually or on demand, I think it just allows more people to be able to, actually do it. But I hope in the future we can, do some cool stuff in person. I'm sure we will. But
Yeah, I mean,
um,
it's very reasonably priced, I think, for what we offer. And also just a shout out that to mention that the intro course, the on-demand intro course, is approved for 6 continuing ed credits from both EMDRIA and APA. So that was also a really big thing that we had to go through to be able to get the continuing ed credits for it.
right. Yeah. So we went through EMDRIA, and then Precision EMDR Academy is co-sponsoring the course, and they're actually
the basic training program that I facilitate for. So that's been a great, a really great collaboration. And so we have lots of plans. I'm sure a lot more will happen this year. 2025 was a huge year for us. We've got lots of plans for 2026. There's other courses we want to launch. We would really love to launch a certification, in our training program. We'll be at the conference again,
With a booth?
with a booth. So if you come to the conference in Anaheim, come find us. So we've got lots of plans, but this podcast is something I'm really, really excited about because I really hope that it helps more people just have a little bit of a better sense of what the heck this is. Because I know for
Mhm.
a lot of people, they see ketamine assisted EMDR and it's like, what the heck is that? Right? It sounds kind of, I don't know, scary or like really mysterious. And I think, we kind of want to break that down and make it not so mysterious and not so overwhelming. And really, like we say this all the time, we want the people who take our trainings to realize that this is just EMDR with an enhancement, right?
It I mean, it is based on the EMDR standard protocol. We really don't make any
Right.
deviations. It is EMDR therapy. It's the EMDR standard protocol with
Right.
a twist.
With a twist, right? So I think when people take the training, what I hear a lot is, oh, okay, I can do this, like this doesn't sound so hard to do. So, you know, again, I hope this podcast also contributes to that. And I really also hope that people who maybe are clients, right, who maybe have come
Exactly.
across this, who are wondering, well, what is it like? That maybe they'll listen and they'll maybe be inspired to try this out, because I think our hope is that this becomes more of kind of a mainstream thing. I mean, we know EMDR has taken off and it's become very popular and you hear about it all the time, celebrities talking about their experiences, which is so cool because at one point it was, a lot of people said it was bogus
Mhm.
and it
Kind of
had all,
fringe.
yeah, right. And now
Mhm.
it's like one of the main modalities that I think a lot of people seek out. So my hope is that we can just keep providing more information so that ketamine assisted EMDR again, it doesn't sound so kind of woo woo or, out there that it could be
Yeah,
more normalized and
yeah,
people can understand what the
yeah,
purpose is and what it's like.
yeah,
Yeah.
and the science behind it, which, again, we have a link to our research paper on our website, and,
Yeah.
so for those people who might be listening that, like you said, might be potential clients for this work who maybe are struggling with their own unprocessed traumas, complex PTSD, or, any sort of trauma-related disorders. I mean,
Yeah.
it could be possible that you'd be a candidate for this, so we encourage you to find out more.
Yeah, definitely.
All right,
Well,
well, we've been talking for a long time. Should we wrap
as
up?
as usual, yes, we probably should. So again, in future episodes, you're going to hear from our students, and we've got a few lined up that we just adore. So I'm super excited about that. And then I'm sure sometimes it'll just be you and I. We'll find something to chat about. So we're going to try to release these maybe about twice a month, but we'll kind of see how it goes. So we'll keep it going, and I hope everybody enjoys this. I hope they find this interesting and informative and inspiring. That's another thing that I hope when people listen to this, they feel inspired, right? That they feel hopeful, that they feel like, okay, there's not that it's a magic, wand or a panacea, but that there is something really special about this that can make a really big impact. So
Yeah, I think that's a great way to end.
yeah. All right, Michelle. I'll talk to you later.
All right. See you, Danielle.
See ya.
Thanks for listening to Loosening Up, the KA-EMDR podcast. If you'd like to learn more, visit www.ketamineassistedemdr.com, where you can find out more about our research, our training programs, and you can also find a KA-EMDR therapist to work with.